Good morning. Welcome back to Open Med School. Today I will be discussing with you renal physiology. The urinary system consists of the two bean-shaped structures on either side of the vertebral column. That is the kidneys. And the kidneys form the urine. It passes via the ureter. It reaches the urinary bladder. From the bladder, it passes via the ureter. Two important diseases you should remember. One is when there is a blockage to the ureter due to a stone. That is a common thing. It produces intense pain. That pain is starting from the loin and it reaches the groin. So the pain is said to be loin to groin pain. That is from the lumbar region, the pain goes to the, it's an extremely painful condition. As age advances, in males, there is a gland called the prostatic gland which is situated, or the ureter is passing through this gland. This gland can get enlarged. That is called the prostatic enlargement. It is called benign prostatic hypertrophy. So what will happen when the prostate is enlarged? There will be difficulty in passing urine. So these are the two diseases you should remember at this time of your career. So you should try to draw the kidneys. The kidneys are bean-shaped structures on either side of the vertebral column. And you can see the kidney has got 3 layers. The coverings are in 3. One is the true capsule, that is the renal capsule. And the surrounding the capsule, you have got a layer of fat. That is the fatty tissue is there. That is the perinephric layer of fat. So it is surrounding the kidney. That is why it is called perinephric, around the kidney. And surrounding this there is a renal fascia which encapsulates the kidneys, and above the kidney you have got the suprarenal gland. So kidney has got 3 layers. One is the renal capsule. Second is the perinephric fat. Third is the renal fascia. Hope this point is clear to you. So now we go to the internal structure of kidney. Again the kidney, the internal, again take a bit of paper and draw the picture. Kidney has got 3 parts. The outer part is called the cortex. Inner part is called medulla. So this part surrounding is the cortex of the kidney. And the inner side there part is called the medulla. The medulla contains a triangular or pyramidal structures called the medullary pyramids. The pyramids open via renal papillae into the calyxes. So it opens into minor calyxes. They join together to form 2 or 3 major calyxes. From the major calyxes, the ureter is rising. So internally, kidney has got 3 parts. One is the cortex, second is the medulla, and third part is the pelvis. Hope this point is clear to you. The medial aspect, here the blood vessels are there and the ureter is going down. This part is called hilum. So what is hilum? Hilum is the area where the vessels are entering and the ureter is going out. So in the picture you can clearly see this. So you can see this part is the triangular region called the pyramids. In between the medullary pyramids, you can see part of the cortex is extending. This is called renal columns. Hope the internal structure is clear to you. So I'll draw once more. So this is the kidney. Outer side is the cortex. Inner part you have got medullary pyramids. And there is a renal columns. And the renal pyramids open via the papillae into minor calyxes. The minor calyxes join together to form the major calyxes. Usually 3 major calyxes are there. They are the upper, middle and lower. They form the major calyxes from where the pyramid, the pelvis is formed and the ureter is coming out. The inner aspect where the vessels are entering and the ureter is leaving is the hilum. So the part of the pelvis with the blood vessel is the renal sinus. This picture again shows the various parts, the renal cortex, the medulla, the renal papillae, the renal pyramids, the triangular regions, and the in between the renal pyramids, the cortex is extending, and this is the region through which the vessels are also passing. They are called the renal columns. And you can see the pyramids are opening into the minor calyxes. Minor calyxes join together to form major calyxes. So major calyxes are usually 3, the upper, middle and lower. They join together and this part is the pelvis. So kidney has got 3 parts. One is the pelvis or the renal pelvis, second is the medulla and third is the cortex. The renal pelvis with the vessels is called the renal sinus. And you can see that the kidney is supplied by the renal artery. So the blood supply via the renal artery and the blood is leaving via the renal vein. Hope this part is clear to you. So this is in summary. The outer part is the cortex, inner part is medulla. Medulla has renal pyramids. Tip of the pyramid is called the papilla and papilla open into minor calyxes. This is the functional anatomy of the kidney. And we have said about the renal sinus, the hilum, that is this region opens into the area called the renal sinus. So the renal sinus includes the renal pelvis with the blood vessels. The renal pelvis leads to major and minor calyxes. Hope the anatomy is clear. If you have about the lymphatics, lymphatics drain the renal cortex. In the medulla, there are no lymphatics. The lymphatics drain the excess of fluid that is not passing through the renal vein, and it is rich in erythropoietin. And the lymph is drained via the thoracic duct, about which we will study later. So, we have learned about the functional anatomy of the kidney. Kidney consisting of 3 layers: the renal capsule, perinephric fat, and renal fascia. Kidney has got 3 major internal structures: the cortex, medulla, and the pelvis. The structures are entering and leaving via the pelvis, through the hilum, and the pelvis with the vessels is called the renal sinus. In the next session, we will be discussing about the functional unit of kidney, that is nephron.